Hello, guys, and welcome to my YouTube channel, Peach's Way. First of all, congratulations that you are done with the part 1 exam, FOP and TAS, and you are planning to take the AKP exam. Okay, and if you are planning to take the AKP exams, then this video is for you. Okay, this is the ultimate guide. You can pass if you follow the guide. You will pass the AKP exam in first attempt with very good score. That's my guarantee. Okay, we have followed this course. My many colleagues have followed these steps and they are done it successfully. Okay, and this is nothing hard, but you need to um, do the things in a smart way. Okay, so today our topic will be approach to AKP exams. Okay, before we proceed, please subscribe to the channel so that I am motivated to making further videos for you. And if you want a video on a specific topic, please do comment. I will try to make a video on that as well. Okay, so before proceeding, we need to have some things for today's videos, some outline. Okay, so number one is sources. And believe me, this is the most important thing in AKP exam, the sources. Number two will be time required. Okay. And number three will be after sources and how much time is required. Number three will be things you can't miss. Okay. So coming to that number one thing, time required. Okay, this is a very tricky thing. Most of the people, when they pass the part 1 exam and they want to get the success hurriedly, okay, like this, but things don't go like this. Okay, so you need to give proper time to the AKP exams. Okay, so don't be in hurry, don't rush, take your time, take some time. Okay, you should have at least 4 to 6 months. Okay, if you are in training in pediatrics, then you can take your exams in 3 months, but not less than 3 months. Okay, never. I won't recommend you to go for the exam instantly after passing. Take some time, calm down, take a deep breath. Okay, because AKP exam, its syllabus is so wide that if you get a difficult paper, you can be in trouble. Okay, so first thing is very important, that you should take ample time, take your time, relax, think about things. Okay, gather your sources and then approach. Okay, so we are done with the time thing. Second thing we will be discussing is the sources. And believe me, this is the most important thing. Okay, so most of the people go for the sources like past test, MCQs. Okay, but here is the problem. If you do the past test MCQs and go for AKP exams, I am bet you will fail 100%. Okay, because AKP is very different from the FOP and TAS exams. Okay, in part 1 exams, the past test MCQs help you a lot. Okay, but the story is very different in AKP. So what sources you need to have? Okay, you definitely will do the past test. Okay, but survival guide, it's the key. You can't miss it. Okay, number two, you are already done mark. Okay, so you can review few things from mark. Okay, number three, clinical cases. RCPCH. Okay, the most important book, new format. Okay, you can't miss it. Then there is radiology. Okay, this is even important and you can't miss it. Okay, this is prime importance. When you are done with survival guide, you are done with clinical cases, you are done with new format, you are done with radiology. Okay, you need to do these books, and if you don't do this, mark my words, you can be in serious trouble during your exams. Okay, so these four books, you cannot miss a single line, you cannot miss a single question. Okay, but the game is not over here. Okay, we need to do some extra things. We need, because this is a long syllabus. When you will do the survival guide, then you will do clinical cases and new format and radiology. You have gone through the subject, but you still need the revision to pick the questions in the exam like this quickly. Okay, so you will do some other books in that 250 questions. Okay, and in this mostly one liner questions are there and you can easily grip them, and this is a very helpful book. Okay, so don't forget to miss this. You definitely need to do the past test. This will help you in revising, okay, the previous content, but it will not tell you the questions that are in exams. Okay, like FOP task, it's very different thing. Okay, these books you all know, but now I will tell you the way you will go through these books. Okay, the way I recommended steps. Okay, first, do survival guide. Okay, and do it by heart. Give it a month or 3 weeks, 4 weeks. Okay, by heart. Then second book you need to do is new format. New format, in this there are around 20 chapters. Okay, and each chapter has 20 questions. Okay, so they have a lengthy explanation. So what you need to do is, uh, what I used to do and I recommend that you can highlight the key points of each question and write it down so that when you are revising, you can revise the whole book in 3 to 4 hours. Okay, do it like this. Then number three, clinical cases, you will do it. Okay, these are 50 cases and you can do it in 3 to 4 days easily, no problem. Okay, number four is radiology. This has around 110 cases, very simple and very important, and you need to do the explanation really well to go through the AKP exams. Okay, then I told you the other books like previously, um, the 250 questions and the mark for some review. Okay, but tip to pass AKP exam is here. In AKP, the syllabus is very wide. Okay, so whatever you are reading in survival guide, in anything you are reading, Google it. Okay, Google it. See the picture. In AKP, there will be a lot of pictures. Okay, so Google it, see the picture, and save it. Okay, so apart from these books, what will make you succeed in this exam is seeing the maximum pictures. Okay, because it's a clinical exam, you will be asked four type of questions mostly. Okay, pictures, a major part. Okay, you will be asked data interpretation. Okay, you need to do this. Then you will be asked ECG, EEG. Okay, tympanometry. Okay, spirometry question. Then what else? X-rays, CT scan, MRI. Okay, so these are the focus questions. Okay, these are the question types you can expect in AKP. Most of them will be pictorial. Okay, and some will be data interpretation, and there will be 1 to 2 question of ECG, 1 to 2 question of EEG, tympanometry, spirometry, and X-rays, MRI. Okay, so you don't need to miss anything. You need to cover the things which are being told. Mostly you will have these questions. Okay, you need to prepare for them. So you need to do ECG well. Common ECGs like SVT is very common. Okay, and VT, VFib. Okay, these are the blocks you don't need to miss on them. Okay, um, then what else? In ECGs you can get, yeah, you can get atrial flutter. Okay, and atrial fibrillation. Okay, and other than that, you can have that, like very important is QT, prolonged QT. Okay, they will give you a scenario that child has collapsed and this is the ECG. You need to calculate the QT interval, and you will see that QT is prolonged. Okay, so long QT syndrome and its causes. Okay, so apart from these, what else you need to do in ECG is the how to calculate the heart rate, basic things, axes. Okay, they can give you like congenital heart disease. You need to know the axes, like its superior axis, its inferior axis. Okay, one thing I missed here in cardiology, you will be asked cardiac catheterization, so you need to do that as well. Okay, so now we are doing step by step type of questions you can expect. Okay, this is ECG. Then in EEG, most common questions you will be having, uh, like EEG of West syndrome. Okay, SSPE, juvenile myoclonic epilepsy, Epson sears. Okay, benign Rolandic epilepsy. Okay, so these are the common EEGs you need to be aware of. Okay, and other, if you find anything any more, you can do that as well. Okay, commonly in X-rays what you get is, like in respiratory, you get emphysema. Okay, cam. Okay, you get pneumothorax, foreign body. Okay, and what else you can get? You can get, foreign body is very common. Okay, and similarly in cardiology, in X-rays, chest X-rays, you can get TOF, you can get agonide. Okay, what else you can get? Epstein. These are very common, so you need to do the common things really well. Okay, then when we come to other things in data interpretation, okay, you need to do data interpretation really well. Okay, like especially you need to interpret the chemistry well. Okay, but electrolytes, okay, like diabetes insipidus and central versus nephrogenic. Okay, like RTA, you need to pick the RTA. Okay, renal tubular acidosis, you need to pick up the congenital adrenal hyperplasia. Okay, and like these common scenarios which involve data interpretation and the interpretation of CBC. I will be making another video on interpretation of CBC. Okay, and like these like data interpretation questions. Okay, now we are done with ECG, EEGs, X-rays, data interpretation. Now I am coming to the pictures. Okay, now pictures are very common and you need to do the pictures really well, really well. Okay, you need to search every topic, everything you read, go take a picture. In some exams previously they have asked the eye pictures. Okay, they have shown the fundus like of toxocariasis, toxoplasma. Okay, you need to be aware of this. Papilledema, how it looks. You need optic atrophy. These are very common. Okay, and if you want these pictures, I do have folders and file I will be posting gradually. Okay, so that you people can have that as well. Okay, like in every specialty there are 10 to 15 to 20 pictures. Okay, like dermatology, derma pictures must. Okay, in dermatology you will have all the conditions like acne, psoriasis. Okay, and other things you need to do them. Okay, similarly rashes, you need to then do the rashes really well. Okay, so summarizing, because this video is getting long, let me summarize. I have told you the sources. You need to do the sources really well. Yeah, here are our sources: survival guide, mark, clinical cases, new format, radiology, and 250 questions. Okay, you need to do the past test as well. um, Data interpretation is the key, pictures is the key. Okay, and x-rays in congenital conditions, you need to do the thanatophoric dwarf. Okay, and one important thing I missed here, I think, like, and they can test you on anything. That's why I'm trying to focus that. Please see the pictures. Okay, once in an exam they showed an x-ray, and it was a baby, and he had a tube. Okay, and there was an NG tube as well, and apart from the NG there was umbilical venous catheter, umbilical arterial catheter, and they posted a question that this is a baby on ventilator. We have taken his x-ray, and what is the abnormality. Okay, so you need to identify the things, and you know what the abnormality was. It was displaced umbilical venous catheter. So now you see the things, you need to do all the things for AKP. You cannot miss anything. Okay, so in summary, take your time. Sorry. Okay, do the sources well, do all the possible pictures, and don't miss past papers. Don't miss past papers. I am focusing. Don't miss past papers. Okay. So, what type of questions you see in AKP? There are mostly the question in which there is more than one to two answers. Like they will give you a child has presented with asthma exacerbation, okay, and his sats are down, like spo2 is 88%, heart rate is 108 per minute, respiratory rate is 60 per minute, child is 5 years old. What will be your two steps? Okay, so you need to choose the two steps, like you will apply oxygen, okay, and what else you will do? You will do labs, or what will you do? You will send abgs, okay, you will give nebulization. So you need to choose these things. So be prepared for these, okay. So this video is getting long, so we stop here, okay, and there's a lot to talk about AKP, okay. I hope this video was helpful for you. And if you find any difficulty, if you have any specific question, please do place in comments below, and I will be happy to answer them. Okay. And so that's for today. And please subscribe. Okay. And hit the bell icon. Okay. Thanks.